Hello guys, this week's videos focus on patient engagement within IT platforms. Studies have shown that most preventable deaths such as smoking, obesity, or medication adherence can be resolved through patient engagement. It was found that real-time communication and feedback was needed to empower patients to improve their health. Patient engagement is the notion of individuals monitoring their own health with the help of health informatics and their own willingness to improve. This is discussed in this week's article, The Impact of Information Technology on Patient Engagement and Health Behavior Change. This paper reviewed around 160 studies in order to understand whether health information technology has either proved a positive or no noticeable impact in care at all. The data that was collected was first reviewed by two investigators in which they determined which studies to include following the predetermined criteria to formulate an answer to the hypothesis listed above. One discrepancy I want to point out is to question whether two individuals have enough credibility to decide whether or not to include or exclude other studies compared to others. The results were calculated by statistical analysis and collectively showed that IT platforms did have a positive impact on patient health outcomes. For example, cancer patients were using Twitter to provide online peer support for each other and discussing treatments online. One thing I found interesting was that 82% of the studies that were included in this review showed that individuals found these platforms very valuable as they can be like a therapeutic online forum. I would like to also note that 11% of the studies showed no impact of using IT platforms on health behavior.
The study also found a significant relationship between patient engagement and internet-based interventions that explicitly utilize behavior theories. And when it comes to the usability of these IT interventions, it was found that 75% of internet-based IT studies showed positive health outcomes with usable interventions. Mobile-based interventions and text messages specifically were used in reminding patients to take their medications and to help them easily communicate with doctors. Text messaging is user-friendly, inexpensive, and efficient way to receive important health information. However, it also places a greater burden on the doctors to be delivering this information. An important limitation of the study is that the timings of the follow-ups were varied, which makes it hard to know how long these positive health effects on the patients last. Factors that currently may be limiting the use of IT in patient engagement include an unequal access to technology, technical issues, a poor interface design, privacy issues, and a patient's self-perceived health illiteracy. And focusing on these issues will help reduce the limitations of using IT in order to increase patient engagement.
An applicable example of patient engagement is through UCI's recent innovation, which is a respiration monitor derived from a children's toy called Shrinky Dinks that targets pulmonary conditions such as asthma and cystic fibrosis. Michelle Klein and her team designed this monitor so patients can constantly track respiration rates and volume to predict future attacks. The device can be connected through Bluetooth, which lets patients quickly receive data. So far, this device has proven successful in healthy patients. Patient trials on affected asthma individuals is the team's anticipated next step. Patient engagement is especially prevalent in this example because through the successes of IT and health informatics, patients are given a device that enables them to have some sort of control in their health through the easy readability and accessibility of the data produced by the monitor. Rather than going through the risks of an attack, patients are given the tools to predict and possibly prevent future attacks, which improves their overall health. A potential con of this is on whether this device will be easily available to all income types and whether the patient will be on top of putting the device on and actually recording data. Because the device is easy to use, I believe the next step is to emphasize the importance aspect of science and encourage patients to habitually check and input data.
Hi everyone, I'm Megan, and I'm going to be talking about the overall things we learned. So the first thing we learned about was patient engagement and how IT platforms are being used to encourage it more. For the results we saw, they were very positive in behavior change and in self-monitoring, which led to better lifestyle choices. There were some limitations, such as unequal access to technology. So to reach the full potential, new theories need to be constructed, as well as selecting the proper ways to measure behavior change. In the second article, we learned about how wearable monitors were developed from inspiration of a children's toy, Shrinky Dinks. The goal was to use the sensors to predict asthma attacks by sending the real-time data to an app on like your smartphone. The sensors use heat shrinking technology and was placed on like a stretchy material so it could be applied to a patient. Michelle Kine developed the sensors after seeing how little hospitals can actually monitor and obtain information. I was very intrigued by the guest lecture and how we see predictive analytics, sensors, and technology all come together and how it can impact the health system. I feel that it is really possible to maybe use these same sensor techniques to help in other areas of healthcare.